I'm from Union, South Carolina. My grandmother would get mad if I said just Union, so I'm actually from Santuck, South Carolina, which most people have no idea where that is. But it's wonderful, it's just in the middle of the country, and so part of why I wanted to be a doctor was because of my family doctor, Dr. David Keith, who is still practicing, still taking care of patients, still loving on them, trying to practice as good a medicine as he can possibly give his patients. Inspired me to want to be similar, that I want to care for my patients well. I want to deliver to them whole person care, getting to know them, not just their medical problems, but their stories, to be able to love them, care for them, to provide excellent care as much as we can. Harvest Free Medical Clinic is a safety net clinic for folks that do not have any insurance or ability to pay for their medical care. And the desire for us at the clinic here is to take excellent care of patients, to get to know them over a long period of time, to help them in the midst of this season of their life, and to demonstrate the love of Jesus as we do that. There is somewhere on the order of 34 million people in the United States who have diabetes. 90–95% of those cases are type 2 diabetes. In our population, where we're caring mainly for 18-year-old folks to 65 or older, that's a sizable portion of people who have diabetes.
So diabetic retinopathy in general is the leading cause of blindness among working age people in the United States. So it's very common in this part of the country because of the relatively high incidence of diabetes in the southeast. Fortunately, the worst forms of diabetic retinopathy are still relatively uncommon, but they are severe enough that they can lead to total blindness.
One of the things about diabetic retinopathy is that in the early stages, patients may be asymptomatic, meaning they may not have any visual symptoms at all. With that, that's actually a helpful thing in terms of screening. If we can find it before symptoms start, then hopefully we can actually do something about it.
So Dr. McGraw, who's a colleague of mine, came to me as part of a project he was trying to propose about getting a camera to do diabetic screening locally, and I suggested that he apply for a Duke Endowment grant and potentially get cameras that we could scatter throughout this whole part of the state and engage the telehealth people at the institution to develop a broader scale screening program that might include people who didn't have the resources to actually get screened otherwise.
First thing in the morning, I go through and I identify every diabetic that we have on the schedule for the day. I put in their order. When they're finished seeing the physician, I bring them back to the retinal imaging camera, and they sit down and I explain to them the way it works. And the camera is actually color-coded, it's very sensitive. So we take the image, and then I explain to them that their images are going to be sent to MUSC.
The greatest benefit is that we've actually detected pretty severe disease in people that otherwise probably would have caused them to go blind, and at least been able to identify that they're the ones that need treatment. So the benefit of telehealth is capturing those people that actually may have disease so we can try and treat them. The people who are getting examined are not as much the problem as the people that aren't getting examined. So people who see their primary care doctor for control of their diabetes may very easily escape an exam. By using these cameras for telemedicine, we can try to get them examined, so to speak, at the point of care when they go in for their primary care visits. And then if they have severe disease or disease that would need to be treated, at least identify that and try and get them to see someone who can treat them. The real benefit of the program, I think, is that you don't have to find that many people who have really severe disease to make it worthwhile. So if you save 3 or 4 people in a year from going blind, that's a huge benefit overall, not only to them, but to the healthcare system in general, because of the costs associated with caring for these people throughout their life with poor vision.
It's really rewarding to be able to work through that and help out some of the patients, and they're so grateful.
It's a privilege to take care of people that often are just forgotten, then just left behind in some ways. And so that's part of caring for people as people. For me, it's a joy, it's a privilege, it's a delight to enter into someone's brokenness and to offer some degree of hope and care and joy when they might have felt forgotten.